Small towns lead the stay-home effort locally. Gael says there's no fuel shortage in the region. Cuba sends doctors worldwide to fight COVID-19. And internationally, pandemic lockdown measures in Europe could last for months. Greetings and welcome to this edition of Headline News Update. I am George Gonzalez. Thank you for joining us. According to the Pan American Health Organization / World Health Organization, Guyana is expected to confirm roughly 1,400 cases of the novel coronavirus COVID-19. This was disclosed by Public Health Minister Valda Lawrence in her daily COVID-19 update. She disclosed that the Health Ministry will have 300 isolation beds in place for persons who have been tested positive for the virus. As of March 30th, 2020, in Guyana, a total of 46 persons have been tested. 37 of the persons have tested have reported negative, while 8 have tested positive. One person's test thus far is returned inconclusive. 36 persons are now in institutional quarantine, while 2 of the cases have been placed in intensive care. The spread of the coronavirus has caused many cities to adopt stringent measures to fight the pandemic. Locally, it seems that smaller towns and regions have been leading the fight here. More from Bibi Bakker.
According to a tally by Johns Hopkins University, the worldwide coronavirus infections have surpassed the 660,000 mark, with more than 30,000 deaths. In an effort to prevent the spread of the deadly COVID-19 virus, curfews have been implemented in various regions around the country. The mandatory curfew implemented in Region 10 on Saturday saw residents and business owners fully complying. This was evident in Linden as well as in the outlying communities such as Ituni, Kokwoni, and Mabura. The curfew was instituted by the Regional Health Emergency Committee to prevent the spread of the novel coronavirus disease. Other small towns have also taken up the initiative to lead this effort with the stay-home advisory, such as Essequibo, Aishalton, and Bartica. These advisories are in place from 6 p.m. to 6 a.m. In New Amsterdam, a new 4:30 p.m. curfew has now been implemented for supermarkets and grocery shops as opposed to 7 p.m. deadlines, which was announced earlier this week. These proprietors are urged to monitor the number of customers seeking services at once. The municipality's Public Relations Department on Sunday afternoon advised that all cornerside bars, nightclubs, and beauty or hair parlors, barber shops, tattoo and piercing shops are to be closed immediately. Fish shops and hangout spots are to be closed completely, the advisory stated. Guyana has now recorded its 8th case of the coronavirus. For Headline News Update, Bibi Bakker.
Thanks, Bibi. Police in Region 7 are currently looking for 2 persons in connection to the discovery of a possible unlicensed firearm. On Sunday morning at around 9 a.m., a rural sergeant was traveling along the Puruni Trail when he approached the vicinity of Kumung Road when the officer observed 2 males standing on the trail. When he approached them, one of the men reportedly threw an object into a nearby bush and immediately fled the scene on a motorcycle. The area was searched, and the weapon with its serial number filed out was found. The pistol was promptly handed over to the police at the Bartica police station. An investigation is in progress. Contrary to rumors circulating on social media, the Guyana Oil Company Limited, Guy Oil, is assuring the general public that there is no fuel shortage. More from Esther Sobers.
On Monday, the Guyana Oil Company released a statement to assure the general public that there is a significant supply of fuel in the country to meet domestic demand, contrary to rumors circulating on a possible fuel shortage, the company said. The general public need not to have any fear of fuel shortage, as Gaia will continue to ensure fuel distribution across the country continues uninterrupted. Further, while the international borders are closed, this does not include fuel tankers. Gaia recognizes that COVID-19 pandemic is a significant global challenge, and understandably there is a great sense of unease everywhere. We would like to assure the general public that the necessary precautions are in place to ensure the safety of our employees and customers for business community. We therefore encourage the media and the general public to disregard any projections being put out in the public domain as merely speculative. While border closing have affected passenger traveling, it has not had such a great effect on most trade routes across the country. However, due to the drop in demand due to the pandemic in conjunction with an ongoing price war between oil-producing nations, oil is trading at a 17-year low, with some analysis estimating prices to go as low as $10 a barrel. For Channel 2 Headline News, Esther Sowers.
Thanks, Esther. Also, a 30-year-old laborer was arrested Sunday morning at Itabali police checkpoint with 977 grams of suspected cannabis as well as a gram of suspected cocaine. The suspect, who resides at 3rd Avenue Bartska and Trinity Street, New Amsterdam, Berbice, is currently being processed for court. After the break, we have your regional and international news.
Hurry down to Zasco on 15 North Road between Camp and Wellington Streets. Quality products at low cost for every room in your home. 65 and 55 inches high-stand 4K smart TVs. Samsung French door fridges. Black & Decker appliances, queen and king size Canadian-made mattresses. German-made pressure pots in 5 to 9 liters. 12-piece pot sets, knife sets, cutlery sets and pans, commercial fans. Samsung smart stoves. Canadian-made 3-piece recliner sofa sets. Air fryers and Hamilton Beach hot and cold water dispenser.
For that reliable, prudent, and courteous traveling experience, your choice is G3 Cabs, located at 228-229 Aubrey Barker Road and Beverly Close, South Reinfeld Gardens. Travel in comfort and safety with our deluxe fleet of new vehicles and neatly trimmed drivers serving our customers around Georgetown. We deliver cooking gas, small packages, run errands, and provide minor vehicular roadside assistance such as jump starts of vehicles, flat tires, spare wheel assistance, and more. Contact us on 218-4982 or 218-4500. G3 Cabs. You can count on us.
This place is really hot. What's wrong with your AC?
It's not working.
Well, we wouldn't be able to continue this meeting anymore because this place is extremely hot.
Wait, please don't go.
Here's a company you can call to get your AC fixed. Action Cool.
Honey, what's dinner? I had a hard day.
I'm sorry you had a hard day, but guess what, babes? I didn't cook today because the stove is not working.
Having trouble at home or at the office? Then call the professionals at Action Cool. Our fully trained technical team have the skills and experience in repairs of all air-conditioned units, refrigerators, gas stoves, washing machines, and a whole lot more. For further information, visit us at 86 Hill and Princess Street, Mandela Avenue, Georgetown, or call us on telephone number 225-7867.
Hey, Radhika.
Chiny man, long time in a hear or see you.
I didn't really feeling too good.
He never give me no coronavirus, not me.
Like she know you can get COVID-19 from a phone call? What? Hear this. When somebody cough or sneeze, they spray small liquid droplets from their nose or mouth. If you're too close, you could breathe in the droplets, including the COVID-19 virus if the person coughing got the virus. And bops! Just like that, you get coronavirus. So, stay at least 1 meter or 3 feet distance between yourself and everyone, especially those who are coughing or sneezing. Or better, stay home and don't go out liming. Hey, Radhika!
Yeah, Chiny man, I be contact all you want now. Me can hear and see you. This is a message from the Ministry of Public Health in collaboration with PAHO WHO.
Welcome back. Bibi Bacchus brings us your regional and international headlines of the day.
Greetings to our viewers. Now we take a look at news in the region and around the world. Due to the rapidly developing COVID-19 situation, St. Lucia's Prime Minister Alan Chesnut on Sunday issued an executive order extending the public safety curfew for residents. The order takes effect today, Monday, March 30, 2020. According to Prime Minister Chesnut, due to the failure on the part of some citizens to adhere to the curfew, re-evaluating the order was necessary as St. Lucia recorded more confirmed cases of COVID-19, with evidence now of possible in-country transmission. The previously invoked curfew was from 11 p.m. to 5 a.m. daily, but the extended curfew will now be from 8 p.m. in the night until 5 a.m. in the morning. Cuba has over 29,000 medical professionals practicing in 59 countries. It also sends thousands of doctors to work free of charge in low-income countries in Latin America and Africa. Now, the island nation is sending medical teams around the globe to help with the coronavirus response. Al Jazeera Ed Augustine reports.
Another early morning, another ceremony to bid health workers farewell. Last week, a troop of Cuban doctors were dispatched to Italy. This week, medical professionals have been sent throughout the Caribbean, to Suriname, Grenada, Jamaica, and today, St. Kitts and Nevis. 29,000 Cuban doctors and nurses are working in 59 countries around the world, and as confirmed cases of coronavirus increase, so does demand for Cuban medics. Medical services are the island's main export, raising more than $6 billion for the state in 2018. But the communist-ruled island doesn't charge for the thousands of doctors who work in more than a dozen low-income countries in Latin America and Africa. The same goes for disaster relief, where Cuban physicians have provided emergency assistance to millions. Almost 1,000 Cuban doctors arrived in Haiti after the 2010 earthquake, where they were the first to set up medical facilities amid the rubble.
More than 12,000 people were willing to fight Ebola, and right now there are thousands of Cubans willing to complete these missions.
While Western commentators assume Cuba sends doctors mainly to expand influence, experts on the island's health system draw a different conclusion.
The root of it, in addition to Cuba's own health system, which provides universal coverage and universal access, is really the belief that Cuba is one of a number of developing countries that is trying to make life better for its population.
From the moment we're born in this country, we receive an education based on humane principles. The principle of solidarity and internationalism is at the forefront of that. This isn't about politics or ideology, it's about humanity.
You're making a big sacrifice. Why are you willing to go?
Because there are other people that need me, people that are sick and dying, and that isn't right. People shouldn't be dying when there are people who can help them.
Ed Augustine, Al Jazeera, Havana.
And internationally, as the outbreak continues to grow across Europe, leaders and health officials are warning their citizens that antivirus measures could stay in place for months. Al Jazeera's Paul Bremner reports.
A steady procession of hearses bring the latest virus victims to the temporary morgue set up in Madrid's largest ice rink. On Sunday, Spain recorded another daily death toll of more than 830 people. Such a small increase on the previous day is seen as a glimmer of hope, but the situation remains critical.
It is very likely that the outbreak is evolving properly, thanks to everyone's efforts. Having nearly 20% of our cases recovering is an encouraging statistic. But it is true that the number of people going into intensive care units is still increasing, and there are many regions operating at maximum capacity and many other regions quickly getting closer to this limit.
The UK has recorded its second successive day of more than 200 new deaths, and the government has put the entire country on emergency footing, unprecedented in peacetime. Asked about the timescale for the current restrictions, the answer came it could be many months.
So I think 3 weeks for review, 2 or 3 months to see whether we've really squashed it, but about 3 to 6 months ideally, and lots of uncertainty in that, but then to see at which point we can actually get back to normal. And it is plausible that it could go further than that.
There's been criticism and controversy over the limited scale of the UK's testing regime, but there is evidence that capacity is slowly increasing. This drive-through test centre in the car park of an animal adventure park at Chessington has opened specifically for National Health Service workers. The Royal College of Nursing, Britain's largest nursing union, estimates that up to 20% of the UK's healthcare workforce is currently at home self-isolating. These testing centres will bring certainty, allowing potentially hundreds of nurses to return to the front line of nursing at a time when the healthcare system needs them most. In France, overwhelming pressure on congested hospitals in some regions has made it necessary to transfer patients to other areas. These patients are being taken by train from the Grand Est region to New Aquitaine. And some French patients are being transferred to Germany for treatment by a combination of German military plane and French military helicopter.
We need to free up some space. When you free up a space, it gives you room for a new patient. And that saves a life, so there won't be a gridlock on hospital resources.
Across Europe, coronavirus restrictions have left the streets almost empty. But the grim prediction is that it will get worse before it gets any better. Paul Brennan, Al Jazeera.
And that is all for today's regional and international news. Here now is your 3-day weather forecast.
That's all for this edition of Headline News Update. Tune in Tuesday at 7 p.m. for another episode. Be sure to subscribe, like, and follow us on Facebook and YouTube, or visit our website at headlinenewsghana.com for more news. Until then, take care.